Well, over the next 24 to 48 hours, we'll see a number of these being done. As clubs look to get the players in, the players will obviously have to undergo a medical. Our player today is Jamie Carragher. Jamie, a medical is something you wouldn't have done very much of during your career, I wouldn't have thought.
No, because as I've always said, I was not good enough to actually get a move or for any club to want me throughout my career. So I never went through the procedure of a medical, certainly on deadline day or through a summer for a transfer. So we're going to go through it and see what it's all about.
Something new for you. How are you feeling about going through and looking at some of your medical history as well?
Well, I'm certainly not in the best of shape, certainly after a bank holiday weekend. So we'll see how it goes.
Matt's our physio. Matt, talk us through exactly what you're going to do with Jamie.
So we're going to focus on the knee and give an idea in terms of some of the structures that we might look at. We'll be asking Jamie about his previous medical history around there. For us as physio staff, we want to know what he's like now, because the likelihood is the manager wants him to train tomorrow. Whereas yes, whereas the doctor is more focused on long term. They're looking at this player's coming in, can we recommend their contract in terms of 3, 4, 5 years? From a physio perspective, can we get a bit of a baseline in terms of the immediate now? So this is a little window into where Jamie is today.
So this is kind of the first part of the medical and the whole process that you go through today.
Absolutely, and we've got some idea in terms of Jamie's previous medical history. We get that information from the recruitment department, and we know how many games he's been playing. We'd have had a discussion in terms of what he's been doing training-wise yesterday and in recent days, so we've got some idea in terms of what we can recommend moving forward.
Okay, we'll let you get on with it.
Okay, so just coming in and having a quick look at the knee here, Jamie, and this is a first point of call where you actually start to develop a bit of a relationship with the player, because you're putting your hands on them, so it's an interaction and you're starting to build that relationship moving forwards. Have you had any problems with this knee previously?
Well, that's the one I had the operation on, isn't it?
Okay. So first of all, we can just, in general, just have a feel of how you're moving, and we can feel that there's a little bit of a lack of terminal extension there, so that could be indicative of previous surgery, whether there's something structural going on there. As an example, one of the things we might look at is your medial ligament down here. So just having a look here to see what it's like in terms of structural stability, whether there's any laxity there. Because in the short term, if you then do go on to have an issue, we've got a bit of a baseline in terms of how that feels for us now, which is really important. One of the other things that's commonly looked at is the ACL. So again, just coming in and having a feel. Can you feel it? Stop in there, okay, so that's your ACL, nice and intact, okay, so that's good from our perspective. And what we could do is we could go on and have a look through a lot of different pathologies, and we would do that typically with your medical, go all the way through the different ligaments, your meniscus, which is a cartilage tissue that sits within the knee, and then we'd also have a look at your major muscles and tendons around that area. So in this position, one of the things we might look at is your patella tendon. Okay, so
that's what I had the op on.
Okay, so this sits with your patella and attaches down into your tibia. How does that feel as I'm going through there?
It's alright. What if you found something that you didn't like, or on this here? How difficult would that be for you as a physio to go and speak to the manager? Or maybe speak to the doctor and say, I'm not sure about this?
Well, this is an example. We might take your patella tendon here and go, do you know what, you've had previous here, it feels a little bit uncomfortable, let's go and get an ultrasound scan, let's image that. No problem with that, that's what this is all about. The other thing is we would be looking at marrying our findings up with what is shown on your other images. So the player's going to go and have multiple MRI scans of the different joints in question, ankles, knees, hip, back, etc. And if there's anything that comes up from your previous medical history, had you had a shoulder issue before, which you had, we'd probably look at doing something around there as well. So if we find something here, it's then about going, okay, let's have a look with the imaging and see whether there's anything that's lining up, and that information would be then passed on to the manager if it was relevant.
So that will be the next stage, and you can join us for that a little bit later on, as well as Matt takes Jamie off to see the doctor. It'll be ultrasound on that patella tendon. Yes, welcome back. Jamie Carragher is back on the couch, and our doctor is Dr. Nigel Jones. And Nigel, just tell us exactly what you're going to do with Jamie now.
Yeah, so Max mentioned that Jamie's got some discomfort in this knee tendon here on the right-hand side. Now, obviously, later on, Jamie will be going to the hospital and he'll get MRI scans of his hips, of his ankles, and of both knees. But sometimes we can get some really useful, quick information from doing an ultrasound scan and just checking that the tendon looks healthy on the screen. So that's what we're going to do. All right, Jamie. So what we're going to do is we're just going to put some jelly on the probe here and have a little look and see how healthy the tendon is looking.
Yes, okay. Fingers crossed.
Fingers crossed.
Jamie, is that one that is the one that you've had problems with in the past, isn't it?
Yeah, that's the one I've had an operation on a good few years ago now. Went over to America to see the famous Dr. Stedman, who'd done a lot of people's knees at the time, but I've never had no issues with it since, really, when I was playing, obviously. Yeah. A few years ago now.
Yeah. Okay. But let's just check it out because you've got that little bit of discomfort. And what you'll see there, Jamie, is obviously so that as we put the probe here on your knee. Okay. So what we can see there. Okay. So that's your kneecap up at the top there. Okay. And as we move down, that's that bony lump there that the tendon attaches to. So the tendon's sitting right in the middle of there. Okay. So that structure there that looks like lots and lots of really thin sheets, that's your patella tendon. And if we go all the way from it up at the top and down towards the bottom, we have a little look at it in that profile. And you know what? Looks pretty healthy tendon, that, Jamie, to be honest. So, and then if we turn around the other way, we're looking at it now sort of as that oval structure. And again, as we move up and down the tendon, we're having a little look at it. And no, I mean, I'm happy that looks like a healthy tendon, Jamie.
I've never ever had a medical before, a proper one. Obviously, I've never moved clubs, but is this what you're talking about now? Is that just standard for every player, or would different players be different going on the back of the injury, record before they come?
Yeah. So obviously these days we get a lot of information, obviously from the recruitment department. Occasionally players get signed obviously very late and we have little information to go on, but a lot of the time obviously the clubs have identified a player who they are interested in signing. The recruitment department will get a lot of information on that player in terms of injury history, in terms of the number of games that they've missed over the last couple of seasons, and then we'll then speak to the player, and ideally, if we can, speak to the medical staff at the selling club to try and get as much information as we can. Because our job is basically to give the manager, to give the football director, whoever, as much information around whether investing in this player is going to be, they can be confident in doing that.
We're getting really close to deadline day now, so some deals will be going through at the last minute.
Yeah.
Does that make it really difficult for you to actually do exactly what you want, to go through everything with the player and almost give that recommendation to a manager or a sporting director?
Yeah, no, absolutely, spot on. I mean, obviously, the more time we get to gather the information, we would do a top-to-toe physical examination. The physios would do a top-to-toe sort of musculoskeletal examination. Ideally, we'd want time to do blood tests to check you out that there was no underlying medical problems. We do cardiac screening to check, obviously, everything's healthy from a heart perspective. We do some concussion screening on you. Obviously, concussion's a really hot topic in all sports at the moment, including football. And then, with that baseline information, we can then make a recommendation to the to the staff of the club who are signed. The more time we've got, the better. Sometimes we have very, very little time at all.
How hard is it for you to go maybe against a manager or a sporting director in terms of signing a player who they really want, but you've done the medical and this is not right for the club in terms of the finances?
That's my job. My job as a doctor, as a club doctor, is to give the club information. The ultimate decision on whether the club signs the player or not is not down to me, is it? My job is to give information and say, look, if you sign this player, these are the potential risks to that player being able to deliver you 40 games a season. And then the manager then has to make that decision, okay, is the risk worth taking? Ideally what you want to do is say, look, we found no problems with this player whatsoever, but sometimes you're giving the manager information, it's then up to the manager or the director of football to make the ultimate decision.
What would your recommendation be about me?
Well,
would you sign me?
I would be making recommendation that discomfort that you're having in that tendon, shouldn't present any long-term problems to you.
A couple of anti-inflammatories, so that one.
Absolutely. No problem.
Some good news for Jamie so far, thanks, Nigel. Obviously, we're not going to go off to hospital and do the MRI scans or the cardiac screening today. What we'll be doing next, though, is the physical aspect of the medical. So join us a little bit later on when we put Jamie through his paces. Well, last time we promised you the physical aspect of the medical. Jamie Carragher's all strapped in. Jamie, how are you feeling about this one?
A little bit nervous. What's this then? Quad test, see me strength.
So this is an ice kinetic machine, so this is the gold standard for assessing strength. What we're going to do is get you set up on here, and this will give us an indication in terms of your baseline, where you are now. So if you do pick up an injury in knee, hip, ankle or any of those muscle groups, we've got some reference in terms of where you're at. But also what we can do with it is have a look at what our normal values are in terms of physical capability and go, okay, do we need to intervene here? Do you need to be stronger in these areas to make you more resilient on the pitch?
Okay. Right, so what are we doing now?
Okay, so I'm just going to set you up on here. Okay, keep that nice and straight for me. Okay, so we're just making sure that we get the right range of motion.
So when you say this is the gold standard, would it just be for the quad strength you're looking for? Is this more than just that?
It's more than that, so we're looking at your quad strength and your hamstring strength. And when we say gold standard, this is the device that gives us the most accurate information in terms of how strong you are. Okay, so what we're going to do to start with is I'm just going to ask you just to bend your knee all the way back, and you're just going to do a warm-up for me, Cara. So out and back. Lovely. Keep
So
working.
I'm not trying to go as hard as I can.
Nope, not yet, but you will be. So you can see the curves on the screen here.
Yeah.
Okay, those curves are indicating how much force you're putting through the system. So you've got your quadriceps here, hamstrings over here. So try and build it up a little bit now, because we're going to build up towards your actual test. No matter how hard you push, this won't go any faster. So you can't beat the machine, but I want you to try. That's it, yeah? Okay, relax. Okay, so you ready? You're going to push out as hard as you can, back as hard as you can.
How many times?
5 times. I'll give you some encouragement. Okay?
I'll need it, yeah?
You'll need it.
Okay.
All right, you ready? Pull back for me.
Back.
Off we go. Push, 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 push. Good. Pull, pull. Go on, Cara. Push, 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 push. Keep going. Pull, pull, pull. Push, push, push. Pull, pull, pull. Come on. Keep going. Push, push, push. Pull, pull. Last one. Push, push, push. Pull, 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 pull. Well done. Woo. How was that? Some good facials. Right, so what we can do now is come and have a look at your...
Ooh, we're not doing it on the left side as well, are we?
Typically you would do, yeah?
Yeah, we don't need to for this one.
So this score here is your force production in your quads and your force production in your hamstrings, and we'd use that data and we'd look at that alongside what the rest of the squad are producing and see where you sit relative to them.
Van Dijk, yeah?
Well, I can't tell you that. He was way better than you, though.
Yeah, I thought he would be. So what am I stronger or weaker on there in terms of the quads and the hamstring?
You'll always be stronger on your quadriceps in terms of that movement that you're doing, unless you've got a major injury. So we expect that, and this is where, like I said earlier, what we do is we'll have a look at that relative to previous in terms of the squad and what we know of other professional footballers to give us an idea of where you sit from that perspective. So for example, if your quadriceps were particularly weak relative to the rest of the squad, we might say, okay, we need to really focus on that strategy around what you're doing on the pitch, because by doing that we might be able to mitigate injury to the muscle itself or to other joints, whereby that muscle will offload those joints.
Okay.
How are you feeling about what you've seen there, Jamie? And how was that test overall?
To be honest, I'm more worried about what other people saw, my facials, when you said to me what I was, because I was really going for it there, but it's just, when you get to my age, it's not the same in terms of how you used to feel. Obviously, as a player, but for a 43-year-old, what are those numbers like?
Terrible. No. No, that's good, Karen. That's good what you've done there. And the facials is fine, because it shows that you're putting maximum effort in, and if you're not putting maximum effort into a test like this, then the numbers don't mean anything.
I think we also saw how competitive Jamie Carragher is still as well. But more to come. We've got one last little test for Jamie to do. So join us a little bit later on as once again we put Jamie through his paces. Jamie Carragher has just completed his medical. Jamie, how was that overall? Your first experience of a medical, as we said earlier.
It was tough. It was a bit of a blow. They had the run for the VO Max. So, I felt to come through it well, so I think I'll be signing in the morning.
Yeah, the VO2 max was the last test that we saw today, and obviously we can show you the pictures of Jamie being put through his paces on the running machine. Jamie, how was that? Because it looked pretty difficult.
It's tough. I think you're trying to get up to 100% maximum. I'm not quite sure I got there, to be honest. I was more wary of pulling my hamstring as I was running. Now the problems you have at this age, but no, it was okay, and it just gives you an insight into what players are doing up and down the country in the last couple of days before deadline day to go through the medical and hopefully get signed with a new club.
Matt, if Jamie had pulled his hamstring there, that would have been an instant fail on a medical, wouldn't it?
Well, that's an interesting point, because I think a common misconception is that players pass or fail a medical, and it's often what's reported in the media. However, from our perspective, what's actually happening is we're providing the club with a series of recommendations, and then it's a decision that the club makes in terms of whether they want to invest in that individual. So it's almost an anomaly, really. We don't actually have a pass or fail in terms of what we're providing them with information-wise.
Jamie, what you've been through today, what's your perception of whether you would be recommended to be signed by a club? And then we'll get the verdict from Matt.
Depends which club, I think. But no, listen, it's you've got to go through a lot now. I think certainly in the days gone past, there was those famous stories of players, maybe in the 70s and 80s, were just asked to touch the toes. They come in, see the manager, and they sign that afternoon. I think there's a lot more to it now, obviously with the money involved as well. It's not just the manager's say, it goes right to the top of the club, sporting directors. So it is a real business decision, really. But as I said, when you get to deadline, there's deals going through in the last half an hour. I'm not sure they can do exactly what we've done all day. So there is still an element of, just get someone past, really, or as he just said before, no one passes or fails, but just get someone through the medical and make sure we sign them.
So Matt, what recommendation would you be giving for Jamie today?
Well, we've had a look at him in terms of his jumps. And jump height, we'd say we'd probably want him to be a bit more powerful if we're comparing him to a squad today. But we have to take into account where Jamie is in his career. Towards the last stages, we'd definitely say. But for sure, in terms of what we were seeing, there would be nothing from our perspective where you'd necessarily be flagging anything of any particular concern. And when you're making any of these decisions, it's all about relative risk with the individual. So we're just framing that for the club, and that's what we do with Jamie.
What I want to ask as well, there must be certain medicals where the lad hasn't done too well, or you're not quite sure if he's right for the club. Have you been offered a few quid to get someone through a medical?
Absolutely not.
But at least you've had good news for the five-a-sides,
Yeah,
Jamie.
exactly. I'd have to give him a few quid to get through, to get a couple of games with Klopp and the lads. But yeah, I'm fit and fired for Friday night.
All good then, in terms of Jamie's medical, and hopefully we've given you an idea of exactly what the players go through. Also the time constraints when it comes, but we'll see a few of these medicals happening over the next couple of days, obviously, as clubs look to get those deals tied up in time for that Tuesday night deadline.